Vice President for Learning and Research at the League for Innovation, and welcome to our last webinar in the webinar series that we've been doing this summer on the Community Colleges and Public Health Project. We're excited about today's part 2 of the Health Navigator Education in Community Colleges program. We have Casey Schmidt, who is Health Navigator faculty at Otero Junior College in Colorado, and she's joined by Jackie Brown, who's Integrated Care Director at the Southeast Health Group, also in Colorado. So Casey is faculty in a Health Navigator program, so we're really thrilled to have her with us. We'll follow the same format that we've been doing. We'll have the presentation, and then we'll have some time for questions. And then toward the end, Dick Riegelman, who's also on the call, and I will be talking about next steps. And we've got some information for you, and then we want to get some information from you. So, Casey, I'll just turn this over to you, and we'll go ahead and get started. I should mention also that we have hit the record button, so we are recording. So, Casey.
Thank you so much for having me here today with you so I could tell you a little bit about the Health Navigation Workforce Training and Patient Navigation Program that Otero Junior College and Southeast Health Group has conducted. Cynthia, it doesn't appear that I have control yet of the PowerPoint.
Okay, I'll just work on that while you talk.
Okay, it looks like that's okay. So again, the presenters today for today's webinar are myself, Casey Schmidt. I'm the lead Health Navigator faculty for Otero Junior College. And as the lead for the program, I helped coordinate, teach, and grow both the Community Health Worker Certificate as well as the Associates of Applied Science and Health Navigation degree program. I'm also working on expanding the curriculum in collaboration with a growing statewide professional interest group, teaching, academic advising, and also, of course, rendering service to the college and its respective communities are other major responsibilities that I have. Prior to joining Otero Junior College in 2013, I served as Executive Director at Benton County Public Health for 3 years. As Executive Director, I oversaw an agency comprised of more than 30 employees who, again, of course, were responsible for protecting the county's residents through the prevention and control of disease and injury. Our agency's numerous programs touched virtually every age, aspect, and cycle of life. Prior to that, I served as a Program Director for a comprehensive tobacco education, prevention, and cessation program in Otero and Crowley counties in Colorado for over 9 years at the Otero County Health Department. And in addition, as a state tobacco education and prevention partnership peer mentor for about 4 years, I provided coaching, mentoring, and support to 10 local health agencies in Southeast Colorado and the San Luis Valley to help improve efficiencies in tobacco program delivery at the local level. I have a degree in health and exercise science with a concentration in health promotion from Colorado State University in Fort Collins, Colorado. I was born and raised in La Junta and returned back to my hometown following college, where I now live with my husband, Bill, and my 4 children that are 11 and under. That's a little bit about me. In addition, we have the other presenter on today's call is Ms. Jackie Brown, who is the Integrated Care Director for Southeast Colorado, or Southeast Health Group. Jackie, you want to do your introduction, please?
Yes, thank you. Thanks, Casey. That was great. Can everybody hear me okay? Good deal. I work for Southeast Health Group. We were the grantee, wrote the application. I am the Director of Integrated Health Care. I'm responsible for providing the coordination to the center's internal, external health care integration programs. I work to cultivate and sustain the interagency partnerships that we work to develop to support the integration of behavioral health care with physical and other healthcare systems. I also work on policy development, development of the RFP for mental health services in Colorado and numerous other things. I've worked for Southeast Health Group for the last 3 years. Prior to that, I was the Director of Public Health for Prowers County for 24 years. Worked with Casey in a neighboring county. I have a master's degree in nursing, family nurse practitioner certification from the University of Colorado. Born in Colorado, have 5 children and 8 grandchildren, and that's enough about me.
Thank you, Jackie.
You're welcome.
So because this grant is funded by the Centers for Medicare and Medicaid, we need to give you a little disclaimer. Of course, this project is supported by CMS. And of course, the contents of this publication are solely the responsibility of the authors and do not necessarily represent the official views of the U.S. Department of Health and Human Services or any of its agencies. Also, the research that will be presented later on in the presentation was conducted by the awardee, Southeast Health Group, and their subcontractors, and findings might or might not be consistent with or confirmed by the independent evaluation contractor. So what brings us here today is that back in 2012, Southeast Health Group really stepped outside of its traditional role as a behavioral health provider and developed an innovative Health Navigator program in collaboration with the local community college, Otero Junior College, the hospital, the Federally Qualified Health Center, and the health department. And the program really enhances cross-system care coordination to improve population health in Prowers County, Colorado. So just to give you a little bit of context about which part of Colorado we're referring to, Southeast Health Group serves a 6-county rural and frontier area. They serve the 6 counties in the corner of the state, including Kiowa County, Otero County, Crowley County, Bent County, Prowers County, and Baca County. Otero Junior College is located here in Otero County. And we have a 3-county service area that overlaps with Southeast. Again, the population of this region is, again, rural and frontier. We have a combined 6-county population of 46,559 with the latest 2014 census estimate. Prowers County, in particular, which is one of the counties within the 6-county region that was targeted for this grant, has a population of just 12,000, just a little over 12,000. So those numbers are important to remember as we move forward in the presentation and we start talking about some of the results that we received. It's also important to note that this region of the state, and Prowers County in particular, definitely is high poverty, with 23% of those persons living below poverty in Prowers County compared to the state rate at about 13%. And our median household income in Prowers County, again, is just over $34,000, whereas Colorado is $58,000. This all translates to, unfortunately, poor health outcomes and poor health factors, which is evident in the fact that overall Prowers County ranked just 49 out of 60 counties in Colorado by the Robert Wood Johnson Foundation County Health Rankings. So the Southeast Health Group really identified this problem back when they submitted this application to this CMS, and that was that in Prowers County, 61% of the Medicaid funds were used by just 3.7% of the Medicaid members. So I'm going to say that again. 61% of the Medicaid funds were used by only 3.7% of Medicaid members, which was even more startling than even nationally, that 50% of the Medicaid funds being used by 5% of those Medicaid members. So they wanted to ask themselves this question: how do we get patients to show up for their routine and preventative care appointments? And the answer was really to try to seek out those high utilizers of the healthcare services and focus intense resources on those individuals to help them get control of their health situation and also help manage that chronic disease. Again, trying to focus on those high utilizers and bringing down that number of utilizers that were costing Medicaid so much money. So if you're interested in more information about hotspotting, which is some of the information that Southeast used to develop this proposal, there's a great YouTube video that you can watch from Dr. Brenner that talks about the hotspots, and this was really the basis for Southeast's work in developing this proposal. So the strategy that was developed with Southeast, again, was to bring together those community partners to help address this issue. So Otero Junior College was invited to participate in this project. Prowers Medical Center, which is the hospital within Prowers County Public Health and Environment, as well as High Plains Community Health Center, which is the federally qualified health center in Prowers County, and of course Southeast Health Group, all joined together to try to address this issue. And one of the first things that happened because of that was that 13 incumbent health workers that were employed among those partner agencies, as well as Southeast hired 6 new employees. They were trained by Otero Junior College in a disruptive innovation called health navigation, and we'll get into the details of that. So really, what do these health navigators do? The health navigators work with any high utilizer in Prowers County, regardless of a behavioral health diagnosis. So again, they were stepping outside of that role of just being a traditional behavioral health provider and began working with any high utilizer, regardless of their diagnosis. They also embedded those health navigators at the local emergency room to begin with, and also at the federally qualified health center for the first 9 months of the project. And they did that to help to recruit those high-risk patients for services, and that was really critical. So they were at the FQHC in the first 9 months, and then there is still a health navigator stationed at the hospital in Prowers County to the state. Southeast Health Group also really changed its identity to also be actively responsible for population health, which is a shift, rather than just sitting on the sidelines and waiting to be called for a behavioral health referral. They really were looking to have a bigger focus on population health. One of the ways that they did that is that 5 of the health navigators were trained to conduct healthier living classes, which is based on the Stanford University model of chronic disease self-management. And these classes were offered to anyone in Prowers County with a chronic disease of any kind, again, not just Southeast Health Group's patients. Another great innovation that was used with this program or proposal was that the navigators were really given means to do whatever they needed to help assist individuals in accessing routine health care and managing their chronic disease. So really looking at what those social determinants of health are and how we can focus on those and help those patients. So those things included like things for transportation to routine medical appointments. Again, the ruralness of Southeast Colorado, a lot of times doctors, especially specialist appointments, are not even within necessarily our region. A lot of times those require extended trips to Denver, Colorado Springs. This can be 2, 3, 4 hours, depending on where you are in the region, to get to those. So that was definitely something that they focused on. Out-of-town specialist visits, they also helped with pharmacy pickups. Again, they tried to look at all of those social determinants of health, things like income, their patients' employment, education, housing, recreation, what their safety was, healthy foods. Did they have transportation? What were their personal social networks, and what were their support systems? Again, trying to realize that individuals that were utilizing the healthcare system and presenting oftentimes in the emergency room, sometimes the reason they were readmitted were not only because of physical issues, but also maybe they didn't have a housing to go to or some other issue that they were dealing with, and how could the health navigators assist them with that. So as this project has wrapped up in the 3 years, this is a snapshot of what the Health Navigators at Southeast, the types of services that they provided to their clients in the last quarter. And you'll see that one of the largest areas that they spend their time on is, again, that group skills training, whether that be through Healthier Living Colorado classes or other skills training that the navigators do with their patients. The next biggest is actually some non-billable type of services, including doing scheduling and reminders. We know how important that reminders can be to get patients to their appointments. A huge part of what the navigators did, again, was transportation. So actually, again, assisting those clients in getting to those appointments. They actually purchased multiple vehicles with this proposal so that they were able to, again, assist those patients in getting to those appointments, which would help them to need higher care, cost care later on down the road. Case management was a piece of that, of course, outreach, and then doing individual skills training with those patients as well.
And I'll add that the transportation, I can just give you a statistic from January. Over 6,000 miles were traveled in January alone getting patients to appointments.
Thank you. So that, yes, that is definitely a huge need, and I'm assuming that that is also a need in other parts of the state as well as other parts of the nation, especially in those rural areas or where access to healthcare can be an issue. So really the exciting news is the results. This graphic shows you Medicaid expenditures. If you look at those original high utilizers that were identified clear back in fiscal year 11 when the project began, you'll see that the costs, what they approached, and how that was brought down through the course of the years to get to this final figure. And I'll show you a table here in a minute that will also show this a little bit more succinctly. So again, these were the original high utilizers from fiscal year 11 who remained in the data set over time. So again, we worked, as I mentioned earlier, this was Prowers County. We were talking about a population of just over 12,000, and the figure was the percent that were high utilizers, so that's going to bring that down. And so you'll see the number that was originally identified as high utilizers was 120 individuals that had a total cost of $3.4 million. So that was really the baseline. And then you'll see they tracked those individuals, those that they could keep in the data set throughout the years. And by 2014, that was down to 2.1 and a savings of 1.3. And in fiscal year 15, which is of course not completed, hence the asterisk, but this project did wrap up with Southeast and CMS in June 30 of this year. These were the figures at that point. So again, these results are the best that Southeast believes at this point. Jackie, did you have anything you wanted to add on that?
Well, the claims data is delayed as always, and that's part of the, things you have to work in, but it can take several months for that to get finalized. But for the purposes of this award, we had to submit what we had, or basically where we were at, and then this will also be evaluated by outside evaluators. So these numbers may change a little bit, but this is our best estimate as to where we're at right now.
So again, very exciting that it looks like this strategy is effective in helping to decrease the cost of healthcare among those high utilizers of the system. So the reason that Otero Junior College is involved is, again, thanks to Southeast Health Group partnering with us. We were a subcontractor on the grant. And again, to address the growing interest of both integrating community health workers and health navigators within the U.S. healthcare and also human services system, OJC developed a community health worker certificate and also a health navigator associate of applied science. And we were very excited when the Health Navigator prototype curricular framework was released by the Community Colleges and Public Health Project, as this was kind of happening simultaneously as we were in the process of finalizing our curriculum. And we're able to incorporate some of that into our curriculum. Again, the timing it would have been great if we would have had it 6 months sooner and could have incorporated even more, but we will be, as we go forward, incorporating even more of the suggestions in that curriculum into our curriculum. But we definitely used it as a framework and are very excited about what they were able to provide to us and we could incorporate within our program. So again, just to give you a little bit of a background of how OJC also interfaced with this project with Southeast Health Group. The first phase of this project, which again for us was in 2012-2013, was we developed a 3-credit health navigation overview course, and we used that course to train those 13 incumbent health workers and the 6 new hire Southeast Health Group employees within that first phase of the project. A lot of these individuals already maybe had a healthcare degree or had even bachelor's degree, so this was kind of an overview course for them. That was our first phase. In the second phase of the project, we developed a 1-year program for community health workers that requires a successful completion of 32.5 credit hours, and we include 90 hours of field work. And we use that first year to count as the first year for a 2-year Health Navigator Associate of Applied Science degree that we developed in phase 3, which was in 2014-2015. And that requires the successful completion of 61.5 credit hours and includes 225 hours of field work. So we really allowed individuals with that, how we have it currently structured is individuals can get the certificate after 1 year, and if they choose to move on, they can obtain an Associate of Applied Science degree with 2 years combining that. So really what we were trying to do at OJC and with our partners is really think of how we can create this field, formalize the field into a career ladder. How can the certificate pull into an associate's degree, and inversely then can our associate's degree transfer to a bachelor's and master's? And we're really, like I said, we're at that phase 3, which would be at the second rung of the ladder. As we move forward, we're continuing to explore options and opportunities with our 4-year partners at 4-year universities to talk to them about making articulation agreements for our students. The discussion is, where does this articulate to? Is it a health education, health promotion? Is it social work, nursing? All of those questions are still ones that we're asking ourselves and are being asked, at least in the state of Colorado, about how we develop this career ladder. So we're at the beginning phases of that, but it's in the works. This is a small graphic, so you may not be able to see its entirety. So at the end of the presentation, there is a link to our website where you can print off a PDF of this so you can see it much bigger. But this gives you an idea of this first draft, what we are doing for our Health Navigator Associate of Applied Science. So you'll see within the first year of that, the first semester, they do several community health worker courses. We talk about an intro. We do community health issues and resources. In addition, we felt like there were some important general education courses that students would need, including, English and computer skills, as well as having them be first aid and CPR certified. Within that second semester, we get more into talking about chronic disease, some of the psych impact of chronic disease, what about end of life and palliative care and patient navigation. Again, we look at some other gen ed courses that we feel are important for them to have a context, so psychology, interpersonal communications, medical terminology, and then one of the really key ones that we found from our stakeholders on our advisory committee that they felt was very important was motivational interviewing. So we've included and started offering that within our campus as well. And then that final semester, students are placed within a field experience within our area, and they complete 90 hours of field work, and then at that point can receive the community health worker certificate. Of course, we encourage students to move on to our second year, which is we've created some additional classes for them to take. Health systems navigation, which is a 5-credit course, so we do 3 credit hours of theory, and where we look at each of the different systems, whether it be the acute healthcare system, social services system, behavioral health, public health, and then we also have them do 90 hours of field work as a part of that. We have a course, community health focus on prevention, again, which has a very big public health focus in that class. We'd like the students to get some basic anatomy and physiology as well as nutrition. Then they do, in their 5th and final semester, we talk about health communications. We do some transition to practice and leadership pieces. They do a final internship of 135 hours, as well as take human growth and development and a math for liberal arts course for a total of 61.5 credits. So this, again, it's just recently been approved and adopted by our college and by our Colorado Community College system. And we know as this field is expanding and is evolving that there will be changes that will need to be made to adapt to some of that environment. But we feel like we are at a good place for where we're at this point. Just to give you a little bit of a snapshot of kind of some of our students, again, it's important to note that we've just finished our 2nd year of the certificate program, and we have not graduated any associate degree students yet, because like I said, we just finished that curriculum in the spring, so we'll have our first graduating cohort of the associate's degree next year. But this gives you a little snapshot. I've got separate slides and graphs on most of these, so the ones I want to really point out here is the economic status of the low income. You'll see that 49% or almost half of our students are considered low income, so we really feel like we are reaching out to that particular segment of our population, which we feel is important, as well as educational standings. The first generation, again, 68% of our students are first generation to attend college, so we feel really excited about that. Let's look a little more specifically at the types of students that we've had within our CHW program, at least through the end of the fall semester last year. We had more female students than male students, although I believe with our last group of students that started in the spring that are not counted in this data set, that would change a little bit, but this is pretty typical for public health and social service fields to have more females and males, but we're definitely working on reaching out to the non-traditional student there. This shows our age ranges of our students, and although Otero Junior College does, the majority of our students are traditional students, that is not the case for our program. We actually at this point are having more non-traditional students, anywhere from 24 all the way up to, you'll see we've had a few that are even over 70, but the majority of our students at this point, 50%, have been between 40 and 60. That's very interesting. You'll see here, and I apologize, the graphic was shown on mine, but it's not on here, a majority, so over 91% of our students are completing our courses or passing our courses. Less than 10% the students are failing from those courses. This particular slide shows a group of our students from one of our semesters, I believe last fall, they were part of our community health resources class, and they conducted a health outreach event about influenza and encouraging flu vaccinations at the college. And as you can see from this graphic, we do have a diverse group of students, not only age but ethnicity-wise as well. And also really loved our participation from our international students as well. Waiting for the graphic to change here. And another thing we were very excited about last April, we were recognized from the Colorado Community College System as a outstanding program, and so we shared that award with our partners at Southeast Health Group. Again, we were very excited and honored to have received that award. And again, Otero Junior College is one of 13 colleges that's a part of the Colorado Community College System. And one thing we're very excited about is anything that OJC and our partners work on as far as curriculum does go into the Colorado Community College System for approval, and then becomes part of our common course numbering system. And any college within that system can begin to offer the community health worker, health navigator courses. And so we're starting to see additional colleges in the state that are interested in that, and so we feel like that's definitely going to expand the reach of the program. So some next steps for the program for Southeast Health Group. Again, their 3-year grant from the Centers for Medicaid and Medicare did wrap up June of this year. However, they were able to leverage funding from some other funding sources to expand the program from just Prowers County, where it had been previously, to their whole 6-county region. They had 6 navigators within Prowers County, and now they're going to have 4 health navigators within that 6-county region. So that's very exciting that they're able to continue that program. And one thing they've also identified as something that they will change going forward is they'll begin to utilize peer specialists to assist with the transportation needs. Jackie, do you want to touch on that a minute?
Yeah, since we're spreading the 4 health navigators between the 6 counties, we knew that there was no way that they could keep up the transportation piece, but we're really invested in the transportation because that's really where we think the savings comes from and helps people stay healthier. And because we are in a rural part of the it has to be thought of when you're doing these things, so that we've been able to utilize the peer specialists now who are taking over the transportation to get folks to appointments. So we're hoping that that continues to work out for us.
And peer specialists, Jackie, correct me if I'm wrong, are individuals that have lived experience with behavioral or substance abuse issues. Is that correct?
Yes, that's correct. They would. There are people that have experienced it in their life in one way, shape, or another, and come in and work with us as peers with our patients and on various programs, not just transportation. They do various other programs too. So it's really a nice blend of resources for people.
So some next steps for Otero Junior College. Again, we were so thankful for Southeast Health Group and CMS's funding to get us started. We were very thrilled to receive a 3-year grant from the Colorado Department of Public Health and Environment that just began this July 1st. And some of our goals within that grant are to adopt and implement the approved standardized curriculum that would incorporate minimum basic competencies that they're working on at the state level in Colorado. So we're very excited about that. We also, of course, want to increase enrollment, increase our completion rate of students in the program. We'd also like to focus on increasing the job placement rate. As we start to graduate more students, we want to make sure those students are able to find jobs. We do have a very wonderful and robust advisory committee that meets at least twice a year that's helped in designing our curriculum, but we would, of course, always, it's great to expand that, so we're going to be looking at doing that going forward. Again, we'll be graduating that first cohort of our 2-year degree in the spring of 2016. And then, of course, most importantly is developing those evaluation and sustainability plans so that we can continue this program beyond the grant funding that we have. So for more information about anything we've talked about today, there's lots additional things that we could share, but with the time constraints, we wanted to keep it brief and succinct and give you an opportunity to ask questions. You can contact myself either via phone, email, or Jackie Brown. Also, you can find updated information about Southeast Health Group or OJC's Health Navigator program on our website. And also a great way to stay updated with both of those programs is by liking us on Facebook. So if you search for OJC Health Navigator program or Southeast Health Group, you can like that page on Facebook, and you'll continue to get updated information about our programs. At this time, I'd like to take an opportunity to see if there's any questions.
Yeah, we do. Thank you so much, Casey. That every time I see those numbers, I just get so excited as a taxpayer that that this is saving some money. But also, I think it's just really great for more importantly, great for the people in southeastern Colorado to have opportunities to go to their doctor's appointments and to improve their health. So thanks for all you're doing on a number of different levels. We do have a few questions. So first, how and where are the field placements determined?
So field placements, typically we at OJC, we have a wonderful nursing program, other allied health programs that we've had in the past before this program began. So we did have clinical contract placements with some of those sites that we have revised those contracts to be more inclusive of all of our students, not just our nursing students. So we have placements at hospitals, we have placements at public health, we have placements at human services, we have placements with behavioral health, we have placements with other nonprofit community organizations that are working to better the health of our community. So that is an important part, is the college, of course, having the contract with that site. And then we work with the students to develop learning goals, and we, as much as possible, we try to let them help select at least their top 3 sites that they'd like to do their clinical placement at, kind of depending on what their goals in and if they have a particular area that they're interested in working in.
And then specifically, what kinds of skills and outcomes do students develop? A follow-up, what are they doing or going to be able to do when they complete the field work?
Well, some of the skills that, of course, we are looking for are verbal and written communications. We talk a lot about ethics, again, interpersonal skills, problem solving. How do they overcome and assist clients in overcoming those barriers to health? They of course learned some basic health information. They need to know a lot about community resources in order for them to assist their clients in connecting them with community resources. Cultural competency is something that's interwoven throughout the program. They do, again, learn some information about end-of-life care and work habits, organization, in addition to a myriad of other topics. And I can get the list of competencies to anybody that's interested if they'll just send me an email.
Yeah, that'd be great. Thank you. Then also, what percentage that earn the certificates actually get employment, and also what's the average income, and where do they get the employment?
Great question. So again, if you'll remember back at we talked about the different phases of the program, and if I can get back there, I will go there real quick. So with it being a new program, we have phase 2 is in spring of 2014 or May of 2014 was the first year that we had graduates from our Community Health Worker Certificate program. We had 2 graduates, so it was definitely pretty small that first year. And as far as that goes, we had 1 individual that was already currently working in the field that went back, that had decided to go and continue her education, and the other student has since joined our second year program. In phase 3, during this year when we developed the associate degree program, again, we of course started a new cohort of students, and I believe we had 9 or 10 students, so it's growing, but again, we're talking small numbers, and we are talking about a small rural area, so that's indicative of those smaller numbers. So we don't have employment data on them yet because, again, those students just finished their field experience this summer. So they will then either have the opportunity to move on to our Health Navigator Associate Program or, of course, look for employment. So we would have those numbers. I believe they do a yearly data collection on that. The college does I believe it's in February. So we won't actually have numbers for that for our 2015 graduates until next year. So again, it's kind of a data lag. But again, we are looking at hearing from the field or from organizations that are interested in these students, anywhere from all of those different types of places that I mentioned as placement sites, as potential places that students may find employment. But again, we're at a very new place right now, so we don't have a lot of that data yet.
And then are there any liability issues related to providing transportation, and if so, how do you deal with those?
Okay, this is Jackie, and on the transportation, the biggest glitch that we run into is that in order for us to provide transportation, they have to be our patient. If they're our patient, then it falls under our insurance coverage. So that's the one area that sometimes gets in the way of transportation. But that is covered under our liability policy for the agency. But the patient has to follow all the rules of transportation, like wearing their seat belt and all the safety issues that we require when riding in a company vehicle.
Okay, thank you. And then another question about the job placement, but I think you've already kind of answered that. Do your students rotate to more than one site during the field experiences?
So in the first year community health worker certificate, we do have that 90-hour field experience, and typically that is at one place. We've kind of struggled with or asked that question about, does it make more sense to have them? But with we feel like it's hard to get a whole lot out of less than 90 hours. So they do that at one spot. However, if they've completed the 2-year associate degree, they will have had 3 different placements at that point, so we would have them at least 3 different sites. There is an option in the health systems navigation class, instead of doing it at one place, for them to spend some time at within each of the different systems. But that's kind of what we're looking at, is wanting them to get exposed to multiple players or sites within the system.
Okay, we've got another question, but I just want to remind folks, if they have any, to go ahead and fill them out. Just use the question feature on your board there. And then the other question is, are you offering any of the courses online, or do you have any plans to?
We have in the past. We did one semester do a hybrid, so that was a combination of online and on campus. We have gone back just because of the amount of work we were doing on curriculum development. We have right now are offering them just on an on-campus format, but that is definitely something within the next year that we'll be looking at, trying to go back to probably a hybrid or an online, exclusively online, where they would be offered to those outside of our service area. One thing we do offer, though, currently is those that are able to connect synchronously with us during class time. We can utilize WebEx or another teleconferencing system to connect students to our class in real time. And we do use a Desire to Learn, which is our learning management system, which has all of our resources, PowerPoints, assignments, everything is, even a majority of our quizzes and tests are done online through that system. So really, we did have a student that completed it pretty much exclusively. They lived in Southeast Colorado, but they worked full time and lived several hours away from campus, and so she connected each class period via the computer and then submitted her assignments that way. So we do have that flexibility as well.
That's great. And then a request to review your statistics one more time. There's a question about how the number of students that you had, total number of students that you had.
Okay. Yes. So again, is it this slide?
Yeah, this looks like the one. The question's about the 119 number, so that looks like, yeah. So that's course completion.
Yes.
Okay,
so of course there's multiple CHW courses.
Right. So
students,
yeah. Each student is represented more than one time in that number.
Yes.
Yeah.
Yes, it could be. Whereas the unduplicated head count would be unduplicated. However, of course, this data is prior to our spring and summer semester. So we do, it's over, the number is over 100 now, at least for the head count.
Oh, for the total number, that's great.
Mm-hmm.
What's the head count at your college, or the FTE?
Our FTE is around a little under 1,500.
Okay, so that's a pretty significant number if you've got 100 in your program. Are there any other questions?
Again, that enrollment number is a cumulative number.
Okay, right.
So over the course of the 2.5 years. So it's not, last semester in the spring, I believe we had it was over 20 students in one or more of the CHW classes.
Okay, so the person who asked about the 119 number is just, I guess, wanting to clarify that this does not represent your graduates. 119 is not the number of graduates.
And as a matter of fact, this slide shows that there's 0 certificates awarded, but that was an error. That it was actually, at this point, it would have been 2. But you're right. No, this is that's not current students. That's just showing the number that take the courses, how many are succeeding.
Mm-hmm. And so the that 2 have completed is it's also indicative of how new the program is. Is that correct?
Yeah. Right. So again, we had 2 the first year and 9, I believe, the second year. So it's new. It's a brand new program. It's new throughout in our region certainly, and also throughout. We're the only program at the time in Colorado that was offering something like this. So it's going to take some time to get some traction and some awareness and understanding among students, as well as for the field and employers to start hiring for these individuals as well.
Okay, so there's another question from Illinois Central College in Peoria. You have the wonderful fortune of being approached by the Southeast Health Group. We will be running from the opposite side and approaching key players in our community. In general, can you name the major players in the community which might be most likely to join in this collaboration for future employment?
Jackie,
this is Jackie. I think all of the same partners we had. I think what we've found is that in Colorado, the community mental health centers are using health navigators. The FQHCs are using health navigators. The hospitals are now getting on board, and I just saw recently that the hospital south of us in Baca County has hired a health navigator. I believe the trend is that almost anybody that's providing some kind of health services, whether it's behavioral health, primary care, the health navigator model is being looked at very favorably. So I would reach out to your community mental health providers, your FQHCs, public health, that some of your public health agencies provide a lot of direct services. Those would all be really good partners to work with.
Okay. And Dick, I just want to bring you into the conversation. Do you have any thoughts about that? Who the colleges might approach in their communities to partner on a project like this?
Well, certainly the community health centers are being directly funded now for Health Navigator positions, and you might look to the other new funding sources. Medicare is now the 30-day readmission rule is a major funding source, and I think that's why the hospitals now are really taking this very seriously, and so that I think you can find ways, even if they're not they may be employed by the hospital, but very much working in the community. So there are, I think the good news is that there's lots of new opportunities for it, and anyone as you've heard, any group that is offering services is increasingly looking at this as an employment option.
So there's another question.
Cynthia.
Oh, sure.
Sorry, it's Casey. I just thought of another one that I had reached out to me within our state and asked more information, and now they're looking at partnering with a sister community college down in the southwest area of the state. But your area health education centers, they may be a good one to reach out to. That might, it's not maybe directly within the healthcare system, but may also be interested in partnering with the college and healthcare partners.
Great. Thank you. Then another question, kind of still going back to the number of students that you have. Among those that graduated, were they all in the same cohort, or did they start at different times?
So yes, we haven't had a real strict sense of a cohort, because we have, as a new program, been offering courses multiple semesters. We've also had students, again, who maybe move more quickly through their program because they've had previous college courses, like their gen ed courses. We've had some students who even have their bachelor's degree come back. So, of course, they move more quickly through that set of classes than a student who's starting it from scratch.
Okay.
If that answers. Did they want to do a follow-up, or did that answer the question?
No. It looks like it. I'm not seeing another question come up.
Cynthia, should we take a little time for the discuss the next steps?
Yeah, I was just going to say we've just got a few minutes left, so we did want to have but the number of questions has been great. So
it's wonderful.
If you have any others, just go ahead and pop them up there, and if we have some time, we'll get to them. I just wanted to make a couple of comments. If you should have the template by now, those of you who are the liaisons to your colleges for the project leads, but I'll send it out again just in case you missed the email. And we're kind of curious now that we've completed the webinar series, what other kinds of things that you would like to have some help with. And we've been, as we've mentioned before, we've been talking with Sophie about perhaps providing some technical assistance, and we're wondering if there's any kind of interest in that, or what kinds of assistance you would want. So if you want to send us an email, or if you have any comments you want to just put those in the question section, that would be fine too. But we're really interested in hearing from you about what kinds of help or resources that you might want, and you think might help you as you continue developing your plans. I also wanted to mention that we're exploring some possibilities for program certification. We have started that process now, and we'll be getting back with you to get some feedback from you on that process as well. So Dick, you had wanted to talk with him, mention a few things as well. So
yeah, I wanted to just bring you up to date on the progress we're making toward the guide. Hopefully, you've been receiving the materials that I've been sending around to everybody who's participating in the call for planning. And the concept is that we'll have a first part of this guide ready this fall, and I will be sending out very soon now the draft learning outcomes, both for courses and a bit for the program overall, for both the public health generalists and specializations, as well as the Health Navigator. So I would very much like any feedback you have in terms of what kinds of things and the content of the material. That material, if it's useful to you, is certainly usable as part of your planning process. So that will be, you will have all of the first part of it this week. At the second part of the guide is designed to include some important additional materials, one of which is your plans. Because we want to do is everybody who completes the plan, we want to have that be available through the League's website. We want it to be part of this guide, and we want to get the word out on what you're doing. So we look forward to including those materials in the guide, the second part of the guide that will be developed in the first half of 2016. So we'll hopefully have a rollout of materials as that continues. In addition, you'll be hearing more about the innovations meeting. Cynthia's planning a really quite prominent role for the public health and health navigation efforts at the innovation meeting, particularly that Tuesday, the 22nd of March. So we hope to see quite a few of you there, and we'll have quite a visible presence on this area. So let's see, are there any other issues that we should talk about? We do want, this kind of a discussion today was very encouraging to see the interest in the health navigation, and we're looking for more feedback from you and more indication of what we can do to help or to find ways to get other people involved to help you with your planning and implementation.
Okay, well, thank you, Dick, and thank you again, Casey and Jackie. It is very exciting to see a program like this in action and to see the impacts that it can have on people's lives and on communities. So thank you so much for sharing, well, for the work that you've done, and also for sharing that with us. And we'll be watching as you enter the next phase of the project. Yeah, we've got another comment that someone's just really eager to see the learning outcomes. So I think now you've got everyone on this webinar is excited and interested in your program, Casey. So we'll be keeping in touch and paying attention to what's going on in Southeast Colorado as we're making progress with all of the other states. So thanks to everybody for all your participation in the webinars this summer, and we'll be in touch and look forward to connecting with you in some other ways. Again, please let us know what we can do and how we can help as we move toward the December 31st deadline for the program planning templates or documents. And then, so we're about out of time now, so we'll just stop this. The recording will be available on our website in just the next couple of days, so stay tuned and we'll let you know about that. Dick, anything else?
Watch out for the learning outcomes email. I'll try to get it out still today, so that you have it in your hands, and any thoughts you have, would appreciate your feedback.
Okay, and again, Casey and Jackie, thank you so much.
Absolutely.
You're welcome. Take care.
Yeah, everybody, thanks a lot.